Hello, everyone. It's a pleasure to welcome you to today's webinar, Emerging Issues on New Tools to Fight Mosquito-Borne Diseases. I'm Keyamo-Onyige, the Country Manager for GBCHealth CAMA, and I will be your host today. This webinar is organized by GBCHealth Corporate Alliance on Malaria in Africa. CAMA is a unique coalition of companies from various industries working together to drive impact and end malaria in Africa. We do this in part by creating platforms like this to learn from each other, to share experiences of what works along with the challenges, and to collaborate on solutions that generate tangible results and impact, starting from the workplace and communities where businesses work. I want to thank our members for the continued support in the fight against malaria. Each year on 20th of August, the world celebrates Sir Ronald Ross's game-changing discovery in 1897 that female Anopheles mosquitoes transmit. No progress has been achieved in the fight against malaria. Since 2000 alone, global efforts have saved 7 million lives from malaria and prevented more than 1 billion cases. But we still have challenges. Mosquito remain unchallenged in many countries. Mosquito-borne diseases continue to afflict half of the world's population and have serious adverse effects on global economy. Over the course of today's webinar, we will present the current state of mosquito-borne diseases in Africa. We will look at the challenges and the strategies for elimination. We'll talk about how can we prevent these diseases and look at innovative ways of actually mitigating and preventing these diseases. And we will talk about the successes and evidences of employing these tools in workplace and community programs. We have an amazing lineup of speakers to dissect this issue, but before I introduce our speaker, I have a few housekeeping items to cover about this discussion and the webinar platform. First, today's webinar will be available on demand on YouTube and in the coming days. Other related content, including the key takeaways and a link to the recording, will be shared with all those who are registered. Also, we would love to hear from you during today's presentation. We want it to be engaging. I see a lot of experts from different sectors across the world who are registered, and I see that they're participating in this webinar. We would love to hear from you. If you have a question for our speaker or you have contribution, please feel free to send it through the Q&A platform on the Zoom platform. We'd love to respond to your questions, and we'll do that at the end of the webinar, the half of the webinar, and we will endeavor to answer questions as time allows. And finally, we would like to encourage you to share today's webinar with your social network using the hashtag World Mosquito Day. Moving on, I would like to kick things by welcoming Michael Sternberg, who is the team lead Global Public Health and Special Projects, Chevron, and a co-chair of CAMA, for his welcome remark. Michael, over to you.
Thanks, Ochuko. Can you hear me okay?
Yeah, I can hear you very well. Thanks.
Good. Thank you. It's a pleasure to be here, and it's also a pleasure to be a co-chair with CAMA. So welcome to this call on World Mosquito Day. I wanted to begin by thanking the speakers and everyone that's participating here today in this important webinar hosted by the Corporate Alliance on Malaria in Africa. More than ever, we need to address ensuring the right tools, knowledge, access, services, and solutions are available to those in need. Mosquito-borne diseases continues to be a major public health threat and burden globally, and specifically across Africa. The threat is ever present and in many regions. In fact, just in the past few months, we've seen confirmed cases of dengue fever and chikungunya in several countries. And then in the case of malaria, after years of steady declines, the number of cases is on the rise. And we know that COVID-19 pandemic is threatening hard-won gains and lives are increasingly at risk. So at Chevron, we've been combating and partnering and supporting disease prevention efforts for decades, particularly in our Africa operations, where we work to ensure safeguards are in place and functioning within our workforce and in the communities where we operate. We can't do this alone. So through strategic partnerships, like with CAMA, we can more effectively utilize our expertise, our networks, our tools, and programs towards sustainable risk reduction, ultimately saving lives and supporting community prosperity, which is, I think, all of our goals. So today's program reflects CAMA's committed efforts to share best practices and foster multi-sector partnerships for malaria elimination. We look forward to a really meaningful conversation. I encourage all of you to actively participate and ask questions. And thank you very much for being here. So back to you, Ochuko.
Thank you, Mike. Thank you so much. So now we turn to the heart of today's discussion. Joining me on this panel includes 4 amazing speakers. Dr. Emmanuel Chanda is a medical entomologist and vector control specialist with over 15 years experience in combating vector-borne diseases, including entomological surveillance, planning, implementation, monitoring, and evaluation of vector strategies and tools in the context of integrated vector management. Melinda Hadi is the head of market access, public health for Vestergaard, a leading manufacturer of long-lasting insecticidal nets with a background in evaluation, public health interventions. Melinda joined Vestergaard in 2012. In her current position, Melinda is the technical lead responsible for overseeing the development of the evidence base for Vestergaard's vector control products. Dr. Rose Peter is currently the commercial head vector control Sub-Saharan Africa at Syngenta. She has more than 20 years experience in clinical research and development, marketing and sales in both public health and veterinary fields for large, medium size and small companies, specialized pesticides and insecticides. And finally, our last speaker, but not the least, Dr. John Gimnig, a research entomologist with the U.S. Center for Disease Control and Prevention. He is currently based in the U.S., but collaborates with partners in East and Southern Africa. His works includes a range of topics related to the biology and ecology of mosquitoes, as those related to the transmission and control of malaria. He also worked scale trials of vector control interventions. So now you have all our speakers on board. We will now dive proper into the discussion. Once again, welcome. I want to welcome you all on board. Thanks for your time. So my first question will go to Dr. Emmanuel. Dr. Emmanuel, you work with WHO, and considering your work in leading and in combating diseases, what are the threats and challenges of mosquito-borne diseases in Africa? And what are the recommended strategies for mosquito control and elimination in Africa? Over to you, Dr. Emmanuel.
Thank you for the question, Ochuko. You are right. Mosquito-borne diseases like malaria, lymphatic filariasis, and arboviruses, including chikungunya, dengue fever, yellow fever, as well as Zika, and those that are zoonotic in nature, like Rift Valley fever and West Nile fever, actually contribute much to the high burden of communicable diseases in the African region. And the threat, I would say the threat is very high, particularly due to this high burden of disease and recurrent outbreaks as well as epidemics. Presently, malaria constitutes 93% of the global burden, in Africa. And dengue is endemic in about 29 countries in the region. And presently, we are having outbreaks in Comoros for dengue, outbreak of chikungunya in Congo, and yellow fever in Nigeria, Mali, as well as Senegal. So to combat some of these diseases, member states have implemented vector control in the context of integrated vector management. But these efforts, sad to say, have been characterized by a multiplicity of challenges. And these challenges include insecticide resistance, residual malaria transmission, as well as invasion of exotic species in the African region. And in this regard, I'm talking of Anopheles stephensi in the Horn of Africa region. And then we have challenges when it comes to sustainability of interventions. We have challenges when it comes to entomological surveillance and monitoring. Also, we have challenges of environmental risk factors, including climate change and other cofactors. Challenges also extend to issues of human resources as well as technical capacity challenges. There is an increasing lack of evidence on which to tailor interventions themselves. And also there is limitation when it comes to response to epidemics, as well as tailoring of vector control interventions to in crisis situations like we are experiencing the COVID-19 pandemic right now. So if the African region is to attain sustainable development goals, as well as aspirations of universal health coverage and global health security agenda, there is need to combat, rather to circumvent these challenges. In 2016, WHO and collaborating partners did actually develop a global vector control response to reinvigorate the integrated vector management approach. And this strategy actually has got 4 pillars. One is on community sensitization, the other one is collaboration, and then integration of interventions and approaches across diseases, as well as entomological surveillance, monitoring, and evaluations. All these being based on the platform or foundation of research, as well as capacity building. In terms of available interventions, there is an array of interventions ranging from those that are chemical in nature, those that are environmental in nature, mechanical, as well as biological. But to get to diseases that are really getting the most toll in the region, in this regard, malaria, the key vector control interventions are indoor residual spraying and the distribution of insecticide-treated nets, supplemented by larval source management, as well as larviciding. But when we look at arbovirus vectors, the emphasis is more on source reduction than it is when it comes to deployment of ITNs. So this is dependent really on the vector that is being dealt with. But right now, there are a lot of innovative interventions that are being evaluated, and that would be very handy when it comes to driving interventions towards attainment of elimination of diseases. And in this regard, we can talk of ivermectin, we can talk of Wolbachia, we can talk of repellents, spatial repellents, and then we can as well talk of other innovative interventions that industry is working on right now. So in a nutshell, that's what would be my response to your question. Over to you. Ochuko, over to you.
Hello, Dr. Emmanuel.
Hello, Ochuko.
Thank you for, I can hear you. Thank you for
Okay,
your
great.
amazing
Thank you.
presentation. Thank you so much. Thank you for that. So moving on to our next speaker, Dr. John from CDC. I know that CDC has been at the forefront of fighting mosquito-borne diseases, especially malaria. Can you kindly share with us CDC's experience investing in malaria control and elimination, especially fighting the challenges that has to do with insecticide and resistance, and how CDC has helped to, or is helping to fight this, to fight malaria and resistance altogether. Over to you, Dr. John.
Sure. Thanks, Ochuko, and good morning or good afternoon, everyone, as the case may be. Actually, I want to talk about CDC's contribution in the context of the U.S. President's Malaria Initiative, which we've been partnering with the U.S. Agency for International Development to implement since 2005. We started in 3 countries, and over time, we've scaled it up to over 24 countries in Africa, another 2 in Southeast Asia, and we have a regional program for elimination in the Mekong region. Our mandate within PMI has been to scale up proven interventions for malaria prevention and control, including insecticide-treated nets, indoor residual spraying, intermittent preventive therapy in pregnancy, and then improved case management, which includes both improved diagnostics as well as the provision of treatment with effective anti-malarials. PMI has been an important partner along with other donors such as the Global Fund and others for scaling up long-lasting nets throughout sub-Saharan Africa. And we've contributed to the scale up of ITNs throughout Africa by procuring LLINs and then providing distribution through mass campaigns, routine distribution through ANC and EPI visits. And then more recently, we've moved to community-based approaches to LLIN distribution, including such things as school-based distributions. And as you may be aware, the scale up of ITNs is, according to some of the models that have been done, have contributed substantially, about 70% of the reduction in malaria prevalence was observed between 2000 and 2015. Although some of the gains have plateaued since that time. Furthermore, PMI has been one of the few donors to invest in indoor residual spraying, and that was one of the, as I mentioned, one of the original mandates of PMI was to scale up indoor residual spraying. And with our support, IRIS coverage of people at risk of malaria in sub-Saharan Africa rose from up to over 10% of the population at risk being covered. I think it reached almost 15% at one point, although it has declined for a variety of reasons since then. One important component of PMI support is for entomological monitoring, and we have a fairly broad view of what that encompasses. It includes monitoring of mosquito populations and mosquito behaviors to look at the impact of our interventions. And then, of course, an important component of that is monitoring for insecticide resistance. And I'm sure many of you are aware that with this massive scale up of particularly nets, but also IRS over the past 20 years or so, has contributed to the rise of insecticide resistance, particularly pyrethroid resistance. Early on, our IRS was implemented primarily with pyrethroid insecticides, and of course, up until very recently, for insecticide-treated nets, the only insecticide that was recommended for use on these was pyrethroid nets. Now, these data are extremely important for guiding PMI's investment in vector control, and as we saw pyrethroid resistance increase in our target countries, PMI made the switch in IRS to move from pyrethroid-based campaigns for their IRS. In many countries, we switched over to carbamates, although with the short life of many carbamates, we soon moved over to primarily organophosphates. in large part because there's a product that has been formulated to last for 6 to 10 months. And for the past few years, we've been investing in that as a tool for indoor residual spraying. Fortunately, within the last few years, there are a couple of new products that have come to market, and PMI is beginning to incorporate these products, which there are two that incorporate a neonicotinoid insecticide, and we're now including those as part of an insecticide resistance management strategy. So this is something that is extremely important to maintain the efficacy of our interventions over time. In terms of long-lasting insecticide-treated nets, we've been slower to move to alternative products, primarily because we didn't have products with that had proven efficacy until recently. In the last few years, there have been trials, though, of PBO nets. These are nets treated with a pyrethroid plus piperonel butoxide, which is a synergist that increases their efficacy against resistant populations with certain types of resistance mechanisms. So there have been trials in Tanzania and Uganda demonstrating the efficacy of these PBO nets. And PMI is increasingly investing in these and incorporating them into our mass campaigns, into our routine distribution. And I think over the next few years, we are likely in most countries to shift to these almost entirely. Furthermore, there have been a couple of new products that have come out that have shown some promise, at least in terms of their entomological efficacy. And PMI is currently working with the New Nets project to help with some of the pilot distributions of these projects, as well as some of the large-scale trials to demonstrate their efficacy. And working with the New Net project, we're hoping to demonstrate their efficacy. And once we do, we're hoping that we will incorporate these into our programs, again, as part of an insecticide resistance management strategy to maintain the efficacy of these products and continue our effective tools for preventing and controlling malaria. Thank you. Over to you, Ochuko.
Thank you, Dr. John, for that insight. So now we'll move on to Melinda from Vestergaard. We all know that Vestergaard is fully invested in malaria prevention using LLINN. And can you tell us more about Vestergaard's new innovation tools and the evidence in using these tools in workplace and community programs? Over to you, Melinda.
Thanks, Ochuko, and thanks as well to CAMA for the invitation to join this panel. I think Emmanuel and John have done well to set the scene for this discussion, and I think this audience is very familiar with the impact of long-lasting insecticide-nailed nets and their substantial impact in the malaria cases. So indeed, we are extremely fully invested in malaria prevention. And Vestergaard's permanets are amongst the core prevention tools that are currently being deployed. And I think to touch on a comment that Dr. Chanda made, I think we've been very pleased to see some of the effective communication that WHO and RBM have put out along with the malaria community to ensure that this effective prevention tool are continued to be deployed in this time of the COVID-19 pandemic. So as bed nets are one of the core intervention tools, we're certainly continuing to invest in the innovation to ensure that effective bed nets are available in the vector control toolbox. So this means that in our R&D pipeline, evaluation of active ingredients or insecticides or even combinations of insecticides that are effective against the wild mosquito populations and the mosquitoes that continue to transmit malaria. And I think to put it generally, the science of bed net development is central in a data-driven company like Vestergaard. So what we have going on in our current product development work and even ongoing field trials, drawn from the experience that we've developed for the evidence base of a net like the one that was introduced by Dr. Gimnig on PBO nets, for example, Permanet 3, which there's a substantial evidence base, both entomological and now that there are also randomized control trials that support the WHO interim policy. to deliver the intended efficacy against pyrethroid resistant mosquitoes. And I think the previous presenters also spoke about what's needed in order to scale up these interventions. So not just to make the tools available, but also to think about the strategies in implementing them. And I think it's really encouraging what's come out from WHO, PMI, Global Fund, and others in looking how to really scale up the available tools, as it also sets the pathway for tools to come. Another comment to share is, I think in addition to maybe what you're thinking around innovation in Vestergaard, I think it's also putting our energies into tools such as IR Mapper. It's an online platform that displays published data in addition to data sets that come from groups like PMI, who make them publicly available. And this is a freely available, public available platform. And we've just gone through now another revision of it to really bring together what we can for this community. And it also informs us to think around what are the tools that we need in the toolbox? How do we then tailor these tools for the epidemiological and entomological delivery strategies? And Dr. Chanda mentioned that, and I think there's a great example being put out by WHO through the high burden, high impact work in malaria. And it's certainly a space that we're very engaged and very interested to stay engaged with. Whilst I think the focus on insecticide treated nets is certainly around the prevention of malaria, I think on this World Malaria Day, I'd like to also just comment on what's been said around the concerns of mosquito-borne disease globally. And certainly dengue, these outbreaks are becoming increasingly common. So as a company, we are open and I think keen to leverage our know-how, I mean, in the obvious sense in terms of treated materials, but to also explore how to tailor our tools or how to develop tools that take into account these other needs to address things like dengue and chikungunya and other arboviral diseases. We know as a company that a good idea, is not enough. So we want to work closely with the implementing partners and agencies and donors to understand what are the characteristics of the tools that are needed to address these mosquito-borne disease challenges. And so this might be, I think, just to tell some ideas of what we're looking at is perhaps they could be tools for the built environment, including screening. And really, ultimately, it's to bring forth what we've learned in our R&D and innovation space to leverage that potentially to other technologies, in other use cases. And ultimately, in addition to the science, it's about partnership and working very closely with the agencies, the implementing partners, and so forth.
Thank you, Melinda. Quite a lot of innovations going on, and we will follow you, like in the space, follow Vestergaard and learn more, hopefully in the future as we move on. So Dr. Chanda talked about two core vector control tools, and he mentioned bed nets, and one other one is IRS. Moving on to Syngenta, I know Syngenta is usually invested in vector control, and one of the core areas is IRS. So Rose, can you tell us about the impact of IRS on malaria?
Yeah. Thank you, Ochuko, for asking us to talk today, and thank you to CAMA. We certainly can tell you a little bit about the impact of IRS. I think, as you know, IRS has been an intervention in many countries since 1947, and we've seen quite substantial control achieved with it. But in the more recent past, and I think this is the important thing to look at, let's, if we talk about the impact of IRS, Dr. Gimnig referred to the fact that that obviously a few years ago we started seeing an increase in resistance, and particularly to the pyrethroids. And with that, certainly one of the newer products to come in was an organophosphate in a very specialized formulation, a capsule suspension. And what the exciting thing about that was certainly when it was applied in some of the USAID programs and various other programs, we were seeing up to a 64% reduction in the cases of malaria after IRS campaigns with Actelic in this particular case. So we saw certainly in Ghana and West Africa, we saw a 61% reduction, Senegal 14%, Zimbabwe 64%, and we also know in Mozambique, we saw reductions of up to 45%. Now, clearly the value of that is that people are not getting sick, they're able to go about their business, and they can go to school, they can go about their business. So IRS has proven to be really effective in in the countries where it's been used. So that's, as I said, one of the major impacts. Clearly, another impact is the fact that when houses are sprayed with IRS, you get full compliance of the people. People are very happy to have their houses sprayed. And this is not only seen in the bigger programs that we discussed, but it's also been seen, for example, in many of the mines and on many of the sugar estates. And we have an example of the Inchalo estate in Blantyre in Malawi. Well, in Malawi, it's about 80 kilometers south of Blantyre, who have about 4,000 permanent and about 2,000 seasonal workers during the peak season. The estate also has 7 company-run clinics, and all the clinics are able to screen and treat malaria cases. Spraying is done within the estate only, and about 40% of the workforce stay outside of the estate. But that being said, what was noticed was that when they first started spraying, well, they've sprayed for many years with the pyrethroids, and they did see reductions. Then obviously with resistance coming in, the numbers of malaria cases started to increase again, and they started spraying with Actelic in this particular instance. And the malaria cases dropped right down again. So it can be used widely in campaigns, and it works exceptionally well. So we believe that as long as resistance is well managed, by rotating your insecticides and following certainly the GPERM recommendations of the Global Fund, you can really see great success. And we also believe that the success of any IRS campaign needs to be measured and reported in terms of the impacts on the critical malaria factors, namely the number of cases that are experienced within a season. So IRS has a great impact across the board. Thank you, Ochuko.
Thank you, Rose. I'm so happy you talked about impacts, because what we are trying to do here is to have impacts and reduce the burden of malaria to a BRS minimum and eliminate malaria eventually. So impact is very critical in all facets of our work. Moving on to, we've talked about innovation, the innovative tools that are available. Now, another thing we need to look at is challenges of actually getting these tools out there. I know that a lot of companies are doing greater work.
Ochuko, we just lost your sound.
Hello, can you hear me?
Yeah, I can hear you.
Oh, perfect. I'm sorry. Yeah. Okay. So I was talking about while we have the tools available, we also need to talk about the challenges and opportunities of bringing it to scale. So Melinda, my next question to you is, what are the challenges and opportunities of actually bringing malaria innovations to scale? From the Vestergaard perspective, what have you faced so far? And how do you think we can actually improve on some of the challenges that we currently face?
The key word there that you said is scale. And so tying in with my earlier comments on maybe the challenge and the process for R&D is there's a fairly well understood sort of challenge in bringing basic research and translating it into product development. But groups like IVCC, the Innovative Vector Control Consortium, PATH, and others have also described this second sort of challenge in bringing innovation to scale. So it's not just good enough that a product is registered or pre-qualified and it's available, but it needs to be scaled up to a degree that its impact on malaria indices can really be observed and appreciated. And so this is a space of, I mean, some might call it implementation research, and this looks at how these vector control tools, could be bed nets, could be combinations of tools or a suite of tools, work in real life settings. And it's already been introduced, but the pilot deployment work of the new NETS project are particularly encouraging. So the outcome of this project is not just to develop a WHO policy recommendation for next dual active ingredient nets, but also to work closely with IVCC as the product development partner, donors and countries on how you make decisions around these tools, and really looking at scaling up the intervention or the suite of interventions. And I would say there's also opening other avenues for looking at modeling and also utilizing and gathering this cost and efficacy data for cost-effective analyses. And so this work, from the time that a product has, certainly been evaluated that it's effective in at least semi-field settings, it's safe, it's a quality product, then it allows it to be deployed in pilot deployment settings. And this implementation work is a really essential, and we're seeing it in real time with the new NETS project for how to really scale for impact. Thanks for the question.
Thank you, Melinda. In the same line, Rose, I would want you to react to the challenges on developing further tools that are likely to be required as we move on to malaria eradication. Over to you, Rose.
Thank you, Ochuko. Syngenta is certainly working hard on developing further tools to move towards malaria elimination and eradication. And in one instance, certainly we're working very closely with both the IVCC and the Bill and Melinda Gates Foundation to bring some new IRS products onto the market and possibly some products for nets. In addition to that, we are looking at broadening our portfolio and providing other products that would really help in terms of elimination. Emmanuel referred to larval source management, and we have some products that we can apply there. So Syngenta is putting a lot of effort and a lot of time into developing new products. And as you know, for every product that we develop, we've probably triaged over 10,000 compounds. So this is not a small job at all, and it's not a job that we can undertake to have a new product to you within like 2 months or whatever. It takes years and a lot of expense to bring these products to market, but Syngenta certainly has new products in the pipeline and is also, as I said, looking to broaden their portfolio.
Awesome. Now we will, I want to deep dive into something that Dr. Emmanuel talked about. Is that in terms of recommended strategies, one of the key items there is collaboration, fostering partnership. We have been talking about tools and getting things out there, and we all know that without partnership, without strategic partnership, we can only do little. So one of the things we advocate for is fostering partnership and bringing, stakeholders together to actually ensure that we have maximum impact and results in what we're trying to do in the malaria or mosquito space. So I will move over to Dr. John. I know this partnership is very key to CDC. If you may, would like to know about how you've worked with the private sector in responses to the fight against malaria and the work that you're doing. Over to you, Dr. John.
Sure. Again, I'll talk about our broader activities within CDC and then PMI, where we obviously are co-implementing with USAID. Within PMI, we collaborate with a broad range of partners, including the private sector, but also research institutions and universities, et cetera. But when it comes to the private sector, we really depend on them for nearly everything that we do, from the development of new interventions and then obviously the manufacture of those interventions. So we're very interested in working with them around that. And then of course, once we procure them, we work with the private sector to help us with the delivery through their supply chain. These are things that we do not have developed ourselves. We don't necessarily invest in product development ourselves. PMI is really more of an implementing initiative. That said, we are acutely aware of the need for new products. We've seen that with the rise of insecticide resistance and how that really threatened the efficacy of our IRS and then insecticide treated nets. So while we don't necessarily invest in upstream development, we do work with other partners in supporting generation of evidence to guide decisions for these new vector control tools. For example, PMI has supported pilot testing of IRS in the past, and we are currently working with the new net project in helping to guide the pilots and evaluation of these next generation long-lasting insecticidal nets. And then on a smaller scale, we do collaborate with companies within countries. For example, in Nigeria, PMI has been collaborating with the Nigeria Liquefied Natural Gas Company, which had been implementing their own vector control interventions. PMI provided support for the conduct of insecticide resistance testing, and the result is that that is guiding their procurement of insecticide treated nets by the company. In another country in Southern Africa, in Malawi, PMI worked very closely with a sugar estate, which had been implementing IRS on their own to, mostly focusing on their staff and workers. And PMI came in and used that as basically as a base of support for our own IRS activities. They were able to provide some assistance in the training of spray operators. We provided some technical assistance. For example, they were spraying 3 times a year when we figured that 1 or 2 was probably adequate. And then through this collaboration, we were able to leverage resources to cover an entire district with IRS rather than just this single sugar estate. And yeah, so these are the types of interactions that PMI has and collaboration that PMI has done with companies and the private sector within Africa.
Thank you so much, Dr. John, for that insight. We have talked about the private sector, but there is still another very key stakeholder that is very important in ensuring that we actually get the work done and get to implementation. So it's one thing to have the tools available. It's one thing to have the conversation. It's another thing to get to implementation, and which is very key. So Dr. Emmanuel, from WHO's angle, I know you put together the strategies, and strategies that work for country A may not be may be tailored in different countries, however, to ensure that we actually drive implementation. How is WHO working with the governments of different countries in Africa to ensure that we drive implementation of vector control strategies in their different countries? Over to you, Dr. Manuel.
Thank you, Ochuko, for the question. I'll start by reiterating the fact that the leadership of WHO Afro is committed to combating mosquito-borne diseases in general. And as such, leadership has ensured that technical support continues being availed to member states in terms of adapting normative guidance that is provided by the organization and ensuring that these tools that are developed thereafter are able to be implemented. And in doing so, we really, like you have rightly put it, work very closely with governments within the African region. And last year in August, a framework for the implementation of the global vector control response that I referred to much earlier was developed, and it was endorsed by ministers from all member states within the African region. using this framework, we are working very closely with member countries to ensure that each and every country is able to implement the identified key activities within the global vector control response, but tailored towards country situations to ensure that vector control remains effective, adapted to local situations, as well as sustainable. But in doing so, we are working with countries at different fronts. So from the policy and strategy perspective, we are working with countries, providing technical support to ensure that countries conduct the necessary needs assessments for vector control, and also be able to use that to identify areas for resource mobilization. Countries are also updating their integrated vector management or vector control strategies, aligning them to the global vector control response. And we are encouraging them also to ensure that advocacy strategies are also developed so that communication is really enhanced. Secondly, we are actually working with countries to ensure that necessary or requisite capacities are developed together with collaborations and also strengthened. So we recognize the fact that this work cannot be for health alone. It's not a prerequisite for the health alone, but other sectors need to come in. So we are encouraging countries to develop multi-sectoral working groups for vector control and ensuring that they reach out to as many partners as possible. Probably ensure that the entire range of partners from the funders, from the to policymakers, as well as implementers and communities themselves who are recipients of the interventions are also brought on board. And beyond this coordination and collaboration that we are strengthening, we are also helping countries to ensure that research aspects are strengthened, and also collaboration with academia as well as research institutions is strengthened. This supports capacity building so very well. And specifically, we are looking at entomological surveillance and helping them also to ensure that entomological data as well as vector control data is plugged to routine information systems. And it's only through this that we can start ensuring sustainability and also facilitate tailoring of interventions to where we are going to have more impact. This is contributing towards creation of evidence base for the scaling up of interventions. This whole effort is not just being done together with the countries, but other stakeholders as well. We are working with regional economic communities and other organizations within these regional economic communities. And we are also working with other entities like AUMA. We are working with E8 Secretariat. We are working with ECOWAS. We are working with West African Health Organization to ensure that we strengthen these aspects I've mentioned here, including development of early warning systems for apple viruses. We are also encouraging countries and working with them, providing technical support to ensure that regulatory frameworks are also strengthened, because that is an area which has been pretty weak. Other than that, we have collaborated with countries or supported countries to be able to utilize other frameworks that have been developed, particularly for the implementation of the global technical strategy for malaria, as well as the roadmap for the neglected tropical diseases. All these go with different documents or guidelines that countries are using at country level. I think I can end there for now. Thank you so very much. Over to you.
Thank you so much, Dr. Emmanuel. You mentioned a lot of things that I think we will that will be helpful in terms of our work moving forward towards malaria elimination. You mentioned communities, which is very key. Whatever innovation, whatever tools we're bringing on board, we need to carry them along. You talked about ownership, which is very important as well. You talked about partnership, collaboration, regulation. All of these are very critical in what we are trying to achieve. So thank you so much once again to all the panelists. At this point, we would like to move into the Q&A session. We have lots of comments and questions on the Q&A already, and I will appeal to the speakers to keep it to 1 minute for your responses. Please make it as short as possible so we can cover as many questions as we can. Thank you very much. And thanks to all our audience, the participants for being engaged already. I can see your comments and your questions. It says a lot about your participation. So the first question, I'll direct this to Dr. John. There's a question here that says, how would you compare the cost effectiveness of ITN, that's bed nets, LNIN versus IRS based on PMI's experience? Based on your experience, how would you compare the cost effectiveness of ITN, LLIN versus IRS?
Yeah.
Over to you, Dr. John.
Sure, thank you. Well, you know, the answer to this is it has been varying over time. And I mean, we're very well aware of the fact that IRS is an expensive tool. Those countries within PMI that are implementing IRS are often spending, you know, a quarter of the budget on just to implement IRS. You know, that said, it depends on the insecticide that we're dealing with. So for, you know, early in PMI, when we were implementing ITNs with just pyrethroids, we were also spraying IRS was being done with pyrethroids. The cost was varied from country to country. It's probably a little bit more expensive in IRS. But then, you know, with pyrethroid resistance, we switched over to carbamates and then organophosphates, and now we're implementing neonicotinoids, and these are substantially more expensive than pyrethroid insecticides. So the cost has gone up, but our effectiveness has also increased. So we're definitely keeping an eye on things, particularly as new nets such as the PBO nets, the Interceptor G2 come along, and you know, constantly monitoring these and adjusting our strategy as the data and evidence emerges. Over.
Thank you. You mentioned PBO nets, and there's a question relating to that here. PBO seems to wash off nets more rapidly than insecticide. How do you think that this will affect eventual efficacy? I think I should direct this question to Vestergaard, since that is your forte. Over to you, Melinda.
Sure, and thanks, Dr. Charlton, for the question there. I think it's important to remember that much of the guidelines on testing of nets have been developed for pyrethroid ingredient nets. And PBO is a liquid formulant, and it's waxy in nature. And some of the tests around washing of these nets may not be suited to the true evaluation of products. I think it's a valid question and concern, and there have been, you know, ongoing data being developed around this. And I think with the implementation of such a product and the scale up of PBO nets, this is where the post-market surveillance and the monitoring really does come in. And Vestergaard, we have generated some of the data ourselves, but we're very keen in working with the partners also to look at this data. And it shows that in our experience, and certainly for the product of Permanet 3, therefore you need a sufficient quantity of PBO to start with so that we can ensure the availability of PBO throughout its lifetime. And these proxy studies such as washing may not be suffice to look at the true dynamics of the ingredient. So both the test method and the method of evaluation needs to understand the chemical and physical properties of the ingredient itself. And this is very true for PBO. So we have phase 3 studies. So this is in the former HUPAS system that look at PBO after real life use for 3 years. And these data are going to be quite critical in ensuring that, you know, this is the quantity of PBO that is expected to deliver the intended effects, be it for permanent 3 or other PBO containing products.
Thank you, Melinda. Dr. Chanda, I have 2 questions for you, so I'll take them all together. One, there's a lot of questions around resistance here, so I'll just collect the questions. What are the control and elimination of malaria strategies in the context of widespread insecticide resistance? I hear one of the speakers talked about rotation of insecticides and what to use in a context of it, or it wasn't well elaborated. I would like for you to talk about that. Secondly, you talked about one of the recommendation framework for countries is to establish multi-sectoral groups. One of the participants is asking, are there specific examples of countries that have done so, especially in the African region? Please share more information about that. Over to you, Dr. Chanda.
Thank you so very much, Ochuko. Starting with the question on insecticide resistance management. Yeah, in terms of managing the phenomena of insecticide resistance, WHO has developed a lot of guidance that is out there, starting with the Global Plan for Insecticide Resistance Management. And right now, there are basically a few approaches that you could use to mitigate this. The first one already mentioned as rotation of insecticides. The other one relates to use of mosaics, and these mosaics relate to spatially using different insecticides at the same time. So in a given spraying year, in one location you could use an organophosphate. In another location you could use a pyrethroid, for example. And then after a year or two, you rotate those in the same areas. So that's a mosaic that you are doing. But you can also manage resistance using the mixtures of insecticides within the same formulation. But this is not yet out there for operational use. But you can as well use different interventions that are based on different aspects. Remember, I did mention interventions relating to chemical interventions as well as non-chemical interventions. So if you are able, depending on the evidence that you are generating locally, you are able to use non-chemical interventions in a given area, that would bring down the intensity or the selection pressure of insecticides. So that's another aspect, another approach that is recommended for insecticide resistance management. But all these are well elaborated in different guidance that WHO has provided. The second aspect of the question relates to the establishment of technical working groups. Within the approach of integrated vector management, for a long time now, WHO has been giving technical support to countries in developing their integrated vector management strategies. And within this, the process towards this actually incorporates establishment of technical working groups. They are called differently in different countries. Some countries refer to them as committees. In other countries, they are referred to as task forces. So it just depends with what the country actually demands. But there are guidelines within the vector control needs assessment guidelines. You have a portion that indicates that, including the IVM and global vector control response guidelines. So countries that have already done this, we have a good number of countries in the southern, in Southern Africa that have done this. We have countries like Zambia. Zambia has got a technical working group on vector control. We have that established in Botswana. We have that established in South Africa. So literally all the countries that have a strategy for vector control have got some form of platform for intersectoral collaboration. So one thing I would mention is to probably appeal to member states, those who have not yet embarked on development of vector controls or updating of vector control strategies, to make sure that they formally make requests through to AFRO, and that will be taken up. I hope that suffices to answer the two questions.
Thank you, Dr. Chanda. Thank you. So I will appeal again to our speakers to make the responses short. I can see that we're over time, and I want to appeal to all participants to just stick with us for a few more minutes so we have tons of questions here. So we'll just take a couple of them and then we'll wrap up. Thank you for your time. Our next question is around communities. Now, while we have bed nets, we have IRS, but we've seen that there are a lot of challenges sometimes in the uptake of this and usage of these commodities, especially around IRS. Rose, you would agree with me that IRS is not being used at the level that you would or we would want it to be used in a lot of African countries. And so, and some of the challenges is based on perception, inadequate knowledge, and costs. So how do we ensure, how do we mitigate or overcome some of these challenges? Because bed nets alone cannot give us the results we want to have. We need an integrated method, vector management, to actually eliminate malaria. And we have tons of challenges. So how do we ensure that we overcome some of these challenges? And how do we encourage governments? Because it's important that they buy into the usage and the uptake of this product. How do we get them to actually, get to start using these tools that are effective in malaria eradication? Over to you.
Well, from my point of view, I think that it has been seen, certainly in communities where IRS has started to be used and the people actually see the impact, which you referred to earlier, reduction in cases, the fact that people can go out and work. And then the communities start asking for it. So I think there's quite a lot of work to be done in areas where you use IRS for the first time in terms of good communication and perhaps explaining or getting people from other communities to come in and explain what the use of IRS has done in their particular instance. I think that's the one thing. In terms of the cost, I don't believe that cost is actually a major function at the end of it all, because the benefits and the impact of actually spraying far outweigh that initial cost. So the fact that, and I mean, we've heard it from country after country where they're saying, well, you know, they're just not using malaria treatment commodities anymore. They've saved fortunes on that. If you talk to the farmers, they say, well, actually, we're not getting sick. We can go out and work. People don't have to stay at home to treat sick people. And when you look at the cost, you have to take all those benefits in, counter all those benefits in, and perhaps put a cost to them to actually work out that an intervention like IRS is actually not that expensive as it is perceived to be at the outset. It might be management intensive for a few weeks, but all the benefits easily outweigh that cost. I hope that answers your question.
All right, thank you. I agree with you. The benefit outweighs the costs. I totally agree with you. So I will pose this next question to PMI, CDC, focusing on Nigeria. There are a lot of participants from the country that wants to hear from you. And they're asking, what is the role of PMI for integrating IRS in Nigeria? Since we know that the major tool that is being used in Nigeria is bed nets, how do we ensure that we integrate the use of IRS into the country's strategy for malaria elimination? Over to you, Dr. John.
I have not been working in Nigeria, so I'll take a stab at it. But you know, like I said, PMI invests in a number of interventions, including ITNs and IRS. I think one of the challenges that faces us in Nigeria is it is such a big country, and you know, it probably has the largest budget of all the PMI countries, but like I said, it's the largest country that we are supporting, and we're trying to find ways to maximize our impact and cover the largest number of people. And I understand even with Global Fund and PMI support, there are a number of states that don't have any support in Nigeria. So for now, we have avoided or opted not to invest in IRS in Nigeria. I think if we were to push it forward, it would require much larger donor coordination, PMI, Global Fund, Nigeria itself, you know, possibly some private sector support to just, you know, we just need the resources, because it is, like I said, it's such a large country. It's a major challenge.
Wow. Thank you. I agree. It's a major challenge, and we need a multi-sectoral partnership to ensure that we integrate some of the tools that we are looking at integrating in different countries, especially looking at Nigeria as a country, how big it is, and what is needed in terms of getting us to where we want to get to as a country. And then finally, the last question before we have the closing remark, I'll take a question regarding, I think this is a very important question. I'll direct it to Dr. Chanda. You mentioned focus. We've been talking about IRS and BedNet intervention, but somebody is talking about also the need of integrating larvicidin. And according to the person, he said, Aquitaine AMF has been pre-qualified by WHO. How and when are we going to start integrating those tools with the core tools, which is BedNet and IRS? So the question is, when do we start integrating larvicidin with those other core tools? Because we all know that it's not largely used and utilized in most countries. So WHO, how can we bring this on board as well to ensure that we have an integrated management control, including larvicide, the use of larvicidin?
Thank you, Ochuko, for this very important question. Yeah, there's been a lot of discussion around larvicidin, but I must hasten to mention, to say larvicidin as well as environmental management. Presently, they are not considered as many thrust interventions because the public health value of hasn't been found to be enough to actually to be taken up as operational interventions. There are efforts that are underway right now to provide that missing information, to actually demonstrate that larvicidin is an intervention that can provide public health value once deployed operationally. And as I'm talking, we are conducting some evaluation in Southern Africa, in 6 countries, and 3 countries are looking at added value of larvicidin over endoresidual, in addition to endoresidual spraying. And then we have other 3 countries providing, trying to provide the additive value of house screening in addition to bed nets. So, and it's not only that research going on, there are other researches that are ongoing now, trying to provide that missing information. Once that information is put in place and is good enough to validate the fact that these interventions can be deployed operationally, then definitely WHO would have to change the policy and include them on main thrust interventions. As for now, they remain as supplementary interventions to insecticide treated nets as well as IRS. That's all I can say for now.
Thank you very much for that elaborate response. I wish we could take all the questions. I'm looking at all the questions we still have to respond to, but I will oblige or appeal to our participants to just, okay, I think we're way over time, so we can take more questions at this time, but we will definitely come back to you with responses to questions that have not been addressed as a takeaway from the webinar. So once again, thank you to all our speakers. Thank you for your insights. Thank you so much for the contribution that's been made so far. We hope to actually move this forward and beyond just talking, implement some of the things that we've discussed on this platform. So at this point, I will welcome Manuel LLuberas to give us a closing remark. Manuel is a public health entomologist with extensive experience in the control of insects of public health and veterinary importance obtained during the past 3 decades in as many continents. He is a member of the Vector Control Working Group of IRBM. He designed the framework for PMI's IRS campaign. He has published extensively on IVM and directed vector control activities in several countries. His contributions to public health entomology were recognized by the American Society Mosquito Control Association with Emeritus Service Medal. Wow. Manuel, over to you for a brief closing remark.
Hello, everyone. I'm very delighted to be part of this meeting. We've covered a lot of ground, and there's a lot of room for further discussion for maybe another 3 or 4 days. But to summarize what has been discussed, there are a number of challenges that we face today. And from my perspective, the best challenge or the worst challenge, depending on how you look at it, is what we're currently going through with this pandemic. Everybody's staying home, at least that's the plan, which brings additional potential problems with the emergence or resurgence of dengue and chikungunya and Zika in parts of Africa. As we stay home, and this is true also in the Caribbean, as we stay home, we fall victim of these indoor mosquito biters that are all day biters, very difficult to control. And we have been arguing for the last, I don't know, number of years of the presence of Aedes in Africa and other parts of the world, and here we are. We are now facing dengue in many parts of the continent in Africa. Chikungunya was identified in Africa, and so was Zika. So they are some of the challenges. The other challenges we have is surveillance, and I would like to, it was mentioned during the conversation, what I would like to propose that I was privileged to be part of a pilot project in Cambodia, where we developed essentially what we did, we told NASA, if you know the chemical composition of a star light years away, can we turn down that satellite, look down to the Earth, and if we tell you the chemical composition of mosquito breeding sites, can we pinpoint those sites? Much to our surprise, within a 65 by 65 kilometer grid with a 0.6 meter resolution, we were able to identify and verify, which was a surprise. We were able to identify 90+% of the sites for all mosquitoes. And we couldn't believe the data, so we went and divided the 65 kilometer grids in 5 or 6 1 kilometer squares to verify the data that came out of the satellite, and it was above 90% accuracy. So the information is there, the technology is there, and we're living in an age of technology. Unfortunately, it is not cheap. It is a very expensive proposition to do that, but the technology is there, and the more people use them, the cheaper they will become. Another thing that was mentioned is these non-chemical approaches. WHO has offset publication number 1, which is, this was published in 1973, Manual on Larval Control Operations in Malaria Programs, and offset publication number 66, which is a Manual on Environmental Management for Malaria Control, Malaria Vector Control. They are available in electronic form. I think, going back to your comment, Dr. Chanda, I think we need to, as a community, we need to figure out a way to update these 2 manuals and bring them up to the 21st century. The information is there. There have been plenty of evidence where larviciding works, especially in malaria programs. And in the face of facing all other mosquitoes, dengue and culex and whatnot, there is a good possibility, and the timing is right, to modify these strictly malaria control programs into true vector control programs, where we throw at the mosquito everything we have: IRS, mosquito nets, larviciding, environmental management, and everything. And let us not forget, part of the non-chemical approaches, let us not forget that we need to engage the communities as much as possible. Not only we need to have them agree to accept the interventions we are imposing almost literally on them, but we can have them be our eyes and ears on the ground, because there's a lot more of them than there are us in the programs. And last but not least, something that we didn't mention, but something that I believe is going to be part of the future, is environmental change. Right now in the Caribbean, we are facing the possibility of a Category 1 storm day after tomorrow, here where I am. And it is bright and sunny where I am, but this is letter L, when in the end of August, when the L was traditionally up in September. So we have more frequent, more dangerous, bigger and stronger storms in the Atlantic, and there are more and more frequent storms in the Pacific, especially in the Indian Ocean. The seasons are reversed, but I think we need to consider that these vector control programs will be, because as of this conversation, those of us engaged in malaria vector control, we are going to be tapped to deal with vector control in the aftermath of a disaster or emergency. Especially look at what happened in Mozambique a few years back. I believe it was only a few months ago that they had devastating rains and mosquitoes coming, from every corner. So we need to consider that vector control is vector control, and we will get tapped to provide assistance to these governments and these communities as mosquitoes in general come up. Again, we can continue the discussion for another 2 or 3 hours, but in the interest of time, since time betrays us, I think I'll just leave it at that.
Wow, thank you so much for that great wrap up. You mentioned a lot of things. Like you said, we can go on and on in this conversation, and we still have a lot to talk about. But just to buttress on some of the things you mentioned, which has been mentioned in the last couple of minutes that we've been talking, communities, engaging the communities is very important. The tools that we are developing and whatever we are trying to put out there.
Uh-oh, we lost Ochuko.
goals. We have to be mindful of current climate, the impact of climate change and environment, and all of the work that we're doing, and see how we can, and even in humanitarian crisis, how do we work in these conditions and get the best out of it. So there are lots of things that we need to consider moving forward, and with the challenges of resistance, all around, and it's just a lot. But I want to say that I know that we have the right people in the room, and even those that are listening right now, we have the right audience from the research institute, from the private sector, from the government, from NGOs, civil society. We are all here, and we have all the role to play to ensure that we'll bring mosquito eradication. We achieve it and we'll bring it to an end. So let's keep up the good work. Yeah, LLuberas, yeah.
One thing that we need to consider is that we have the capacity at the highest level possible. There's a few entomologists like Dr. Chanda in Africa. What we need desperately is mid-level and field managers, so that we have the connection from the field to the guys who are making the decisions. Now, that is something that we all need to work on, the mid-level to the lower level managers, and people who can make decisions on the spot without having to go 3 or 4 days up to some manager to say, okay, do this, and it's too late.
And that is critical for implementation. Yes, that is critical for implementation and having the impacts that we're looking at. So there's a level of getting the policies set up at that level, like you mentioned, and getting to the field and getting the work done. So we have to bridge the gap and ensure that we get the work done. Thank you so much. I wish we could go on, but we can't at this point. So thank you all. We will get back to you with a report from this meeting and the key takeaways, and we will continue the conversation and ensure that we win the war against the mosquitoes. Have a very good day, whatever part of the world you're in. Bye.
Ciao.
Yeah.
Thank you.
Thanks.
Bye.
Thank you. Thank you. Bye-bye.
Bye, everyone.